Now, lymphedema. It's a condition estimated to affect about 250 million patients worldwide, but advocates are concerned many are falling through the cracks due to misdiagnosis and negligence. Now, in patients with lymphedema, the lymph system is damaged or blocked, leading to swelling, most commonly in the arms or legs. Without proper treatment, they can end up with potentially dangerous infections and costly hospital stays.
You gotta do bandaging. What, just a quick.
A class is in session, and in this class, the practical exercise of managing lymphedema is going on. For the first time in Kenya, the management of a condition that on many occasions has been misdiagnosed and ignored, leading to severe cases, is being given attention. Students undertaking physiotherapy at Amref University take on the week-long lymphedema management certification course accredited through the Kenya Society of Physiotherapists in order to reduce the cases of misdiagnosis. Lymphedema, also known as elephantiasis, is a chronic disease characterized by massive swelling of the limbs or tissues. The disease affects about 250 million patients worldwide. It occurs through the accumulation of fluid and other tissue elements that will normally be drained by the lymphatic system. The origin can be genetic or more commonly secondary to injuries, with the most common persons susceptible to secondary lymphedema being cancer patients.
Any patient who's ever had lymph nodes removed, radiation, or has had cancer treatment is at lifelong risk to develop lymphedema because their lymphatic system has been damaged and disrupted. And so it might not happen now, but it might happen 5 years, 10 years, even I've seen patients 20 years later, their arm starts to swell after breast cancer or in the legs after some type of gynecological cancer. So it's a really important thing to educate and teach patients that they can wear compression early on to not develop the swelling.
Kenya has one certified lymphedema physiotherapist, Victoria Choi, who explains how to check if you could be developing lymphedema.
So at a point where somebody will be able to say that I have lymphedema is that they first start feeling like the legs are, if it's the legs, the leg will look swollen a little bit. Probably if they sit for too long or if they stand for too long. And then when they go to sleep, the next day in the morning, they wake up, it's not swollen. The other part which they might be able to notice that they will start feeling like the clothes are not fitting well. Like if you wear a trouser, you feel like the trouser is tight on one leg than the other. So that's a sign that actually lymphedema is setting in. For the arm, right now, breast cancer is on the rise, and most of the patients actually get lymphedema of the arm. Because it has interfered with the lymph nodes, probably the lymph nodes have been removed or patients have gone through radiotherapy, then you find that the lymphatic system has been interfered with. And so the fluid cannot be able to pass through the lymph vessels into the nodes and be drained back again to the heart the way it's supposed to flow. So they will also start feeling like heaviness, tingling sensation. They feel the arm gets tired.
For Eunice, the management of lymphedema has been happening for the past 12 years, an exercise that started at the onset after she underwent surgery after being diagnosed with breast cancer.
It started after I was diagnosed with breast cancer and lost one of my breasts to the disease. Apart from losing one of my breasts, they also, for a treatment or planning for treatment, they had to take out some few lymphatic nodes under my armpit. I was just warned you'll experience some swelling. And true to that, I did experience swelling during my course of treatment, and especially when I was going through radiotherapy. With the constant heating and cooling of the body, you find that the lymphatic fluid moves more freely, and because it didn't have receptors to tell it to empty back into the body, my arm continued swelling, and now I started experiencing the onsets of symptoms.
To an onlooker, it is hard to notice that she has lymphedema because the therapy that she has been taking has brought about significant change.
Very keen eye. Very keen eye to see the difference.
For the therapy, Eunice uses compression sleeve that's made in line with the patient's specification and size, helping to reduce the swelling in an attempt to make the arm or the leg back to its normal size.
but it is tighter than this. This is loose. This is not my size. That's why I say not every size. It's not a one size fits all. It has to be fitted to one's body. Yeah, and why I like
managing lymphedema has been a journey, one that she continues to walk as she puts in the effort not to make it worse and learning to live with it.
In them, don't get tired. Never give up. Yeah, and exercises are as simple as just lifting your arm up when you're showering and let the water fall down through it, because there's something we call aquatherapy, and the movement of water kind of relaxes the body, and once the body is relaxed, you'll notice there's not a lot of accumulation of fluid in the arm, and then also giving the arm enough rest.
Her call to action to the general public is creating of awareness and dismisses the idea that lymphedema is a disability. The training here then seeks to have more success stories of managing lymphedema and avoid cases of swellings being dismissed as non-issues. Students are taken through how to bandage patients with lymphedema. Suzy says the management of the condition, if started early, could be prevented from worsening, stressing on the importance of ensuring that physiotherapists learn the skill of handling lymphedema patients and how much this training could change the lives of many.
So the importance of physiotherapists to know how to do this is that they see patients every day who are dealing with swelling. And the techniques that we learn in our physiotherapy and occupational therapy programs doesn't really teach us effective ways of treating swelling. We do something called just massaging from the bottom to the top. But with the training that we're doing right now, it's teaching them about the lymphatic system and really stimulating the lymphatic system to work better, more efficiently, and then patients will heal quicker, their wounds will heal quicker, they'll get better after their surgeries faster, any type of surgery, and also it prevents people from getting infections and being hospitalized. So it actually saves the healthcare system money if patients are managed properly with their swelling getting under control earlier.
In most cases, there are myths associated with lymphedema, which leads to worsening of the situation. However, whichever stage, experts say it is manageable.
Yes, so if the doctor and healthcare professionals recognize that when patients first start swelling, they can come to a therapist or they get into compression garments earlier, they will never develop those huge swellings. So preventative measures, there's definitely risk reducing measures. We have a list of about 20 things that you can do to prevent swelling from occurring.
Cases of misdiagnosis are rampant, making managing of a worsened situation a little bit tricky.
So it's a huge population of people who are misdiagnosed because patients often go to their doctors and they ask, what can I do? What can I do? It's still swollen. And the doctors usually say, oh, it'll go away in 6 months. Just keep elevating your leg, or they get put on a diuretic.
It is one condition which I can say is misdiagnosed, misinformed, and mistreated. When they go to the hospital and probably they found a doctor who doesn't actually understand how to go about the management of the lymphedema, or to refer, because actually the bit is referring the patient to the specialist who can be able to handle. Then they might look at the leg is swollen and they're put on antibiotics, they are put on painkillers, and they just go back home.
So what role does physiotherapy play in management of lymphedema?
But even with the surgical intervention, this requires also specialized care in terms of lymphedema management, so that at least we can be able to achieve good results. So the physiotherapists are basically more involved in management of lymphedema.
There is no cure for lymphedema, but it is usually possible to control the main symptoms using techniques to minimize fluid buildup and stimulate the flow of fluid through the lymphatic system. These include wearing compression garments, taking good care of your skin, moving and exercising regularly, having a healthy diet and lifestyle, and using specialized massage techniques. Brian Amoy, Look Up TV, Nairobi.